So depression and anxiety are quite common in our society. Many people struggle with these disorders at some point in their lives, and many people want to try to treat them as naturally as they can without going on medication. So I'd like to talk today just about a handful of things that you might want to consider if you are exploring a natural treatment for depression or anxiety. Diet can play an important role in trying to manage depression and anxiety. We need to make sure that we're eating a diet that's rich in fruits and vegetables. That's a good baseline. Sometimes lowering our consumption of meat can be helpful as well in these conditions. We still can get our protein from nuts and other plant sources, and even with the occasional consumption of meat. But in general, having a diet rich in fruits and vegetables can be quite beneficial in the management of anxiety and depression. After we get that baseline established, there's a few extra things you can try supplementing to see if it makes a difference for you. One study in China found that in those that had a high folate consumption, in China they actually had less depression. And so it seems that this folate, B12, B1, B6 can oftentimes be deficient in someone who's suffering with these mood disorders of anxiety and depression. So supplementing those, not just with the diet, but sometimes with an over-the-counter supplement, can be helpful in making sure that you have the precursors needed to make the neurotransmitters in the brain. You say neurotransmitters, what's that? So inside the brain we have chemicals that help control and regulate our mood. And these chemicals, how they're made, needs B12, folate, B1, B2, B6, and a lot of other cofactors. And so sometimes, due to our standard American diet, we do have some insufficiencies in the diet that correcting or supplementing and giving some optimized doses, we can see an improvement in the anxiety and the depression. We also want to make sure that we're getting enough essential fatty acids. EPA, DHA, or fish oil is a commonly used supplement, but we also want to remember the ALA and the GLA. There's actually 4 essential acids, and I actually in my patients use a supplement that combines all 4 essential fatty acids into the treatment. Another good way to get these is with nut consumption and also with flaxseed. But if you use flaxseed, you want to make sure you buy it whole and then freshly grind it before you consume it so that the oil doesn't oxidize. There's many other botanicals that can also be helpful. Some people get benefit from St. John's wort, inositol, and several other substances. But usually for these, I like to see the patient first and try to get a good idea about whether or not that kind of targeted therapy would be appropriate for them.